Hello and good afternoon. I am Dr. Saadia Mian, and I am so excited today. I have a special guest. Her name is Jennifer Holcomb. And today we are going to be talking about radiofrequency ablation of thyroid nodules. And Jennifer is a real life patient who had this procedure done a few years ago. And in a little while, we're going to get to hear her experience in detail. I'm really excited about that. Before we do that, I am going to share a little bit about thyroid nodules and about the thyroid in general. So here's this is called thyroid radiofrequency ablation of thyroid nodules, and we call it an option to save your thyroid. And you'll find out in a moment why. So the thyroid gland is a butterfly-shaped gland that sits right below the Adam's apple. So where it says thyroid cartilage, that's what the Adam's apple is. And it sits on top of the trachea or the windpipe. The thyroid produces thyroid hormones, which come in the form of T4, which is then converted to T3, which is the active hormone. What thyroid hormone does in the body is it affects everything. Sometimes we don't realize it affects every single cell in the body. It controls our metabolism. People who don't make enough can have symptoms such as weight gain, feeling cold all the time, losing hair, constipation, feeling really tired too. And people whose thyroids are overactive and make too much, they might feel opposite symptoms such as heart palpitations, or they can have weight loss. They can feel sick all the time, tremors. So the thyroid is very important. And on a day-to-day basis, actually, the hormone levels can fluctuate. It's like a beautiful symphony happening with the rest of the hormone axis in the brain. And sometimes you can form what we call a nodule on the thyroid. If we look at the top picture, it shows what a normal thyroid gland looks like. And if you look below that, we see a thyroid with a single nodule. And next to it, we see a thyroid that has multiple nodules on it. And what do we say when we mean nodule? It's a conglomeration of thyroid cells, so they form together. Another word for them is tumor, but I don't like to use that word because not all nodules are cancerous. And when people hear the word tumor, they often think cancer. Sometimes these nodules can be filled with water, so they can be cystic. And sometimes they can be a combination. So there can be some solid tissue and there can be some cystic fluid in there. So what happens when you find out you have a thyroid nodule? Usually it's found, sometimes it's found by accident. You might go for some imaging of your head or neck, maybe for headaches. You might have Dopplers done for your carotid arteries, and this is kind of found, what we say, incidentally. But sometimes it's found because you're having symptoms and you're sent to an endocrinologist. We do an ultrasound. That's how we look at nodules and we measure them. If you have a nodule that's greater than 1 centimeter, usually that's the indication that we are going to do a biopsy to make sure that it's not cancerous. This is what the procedure looks like. We usually numb this area over the thyroid. And then using ultrasound guidance, we go through with a needle, we get some cells. We might do a few passes and we send them to the pathologist. So after the biopsy is done, there's 3 possible options of, actually there's a little bit more, but I'm going to focus on these 3 outcomes. So there's malignant, meaning cancerous. There's suspicious, which means that there's a chance it could be cancerous or it could be benign. It's about 50-50%. And or it could come back benign, which means there's no sign of any cancerous cells. This chart shows what are the options with each of these outcomes. So If we have a malignant nodule, meaning it's cancerous, then RFA is not an option. In that case, the person must have surgery and have the nodule removed and or the entire thyroid. Okay, complete thyroidectomy, as we say. Suspicious, RFA is also not an option. In this case, surgery must be done. The nodule must be removed, and then it's looked at in more detail to see if there's any cancerous cells in there. Sometimes the result can still be benign, as I mentioned, and sometimes it will come back cancerous. But for both of those options, the only option is surgery. Okay, at this point. Now for benign nodules, those are the ones where you get to choose if you're going to have surgery or if you're going to have RFA. And I'm going to talk a little bit more about both scenarios. Okay, so when we look at surgery, what are some of the complications of surgery? Now, there can be damage to the recurrent laryngeal nerve, which is the nerve that controls the voice box. And this happens in about 1 to 2% of cases. So not extremely common, but I will tell you, all it takes is to see one case to, after that, really, really think about, am I going to send this patient for surgery? Is it 100% indicated? My goal is if I can save any patient from having to have surgery, I try my best. Because imagine somebody who's had damage to this nerve and for the rest of their life, now they're going to have a hoarse voice. And for some people, they can barely speak at all, which is quite traumatic. And there can also be damage to the parathyroid glands. That's in 1 to 3% of cases. What do the parathyroid glands do? They release parathyroid hormone, which control the levels of calcium in the body. Now, some cases after surgery, you can have a short-lived hypocalcemia where there's some swelling from the surgery. So you might have some low parathyroid hormone levels for a little while and they recover, which is great. Sometimes in a small percentage of patients, it's complete permanent damage and their thyroid, their calcium levels will be low for the rest of their lives. And that is also, it can be tragic and it can actually be deadly. Sometimes we don't realize it, but it can be a deadly situation. And the last thing, which happens after having your entire thyroid removed, is the need for lifelong medication, which I definitely do not like to vilify medication ever, because if you need medication, then, if you need medication, you need it. And, but I always believe that we cannot compare our own thyroid to medication. Like medication is never going to be as good as our own thyroid, because that's, God gave it to us and it works absolutely perfectly. Okay, so moving on. This is the procedure, which again, it looks like exactly, the procedure is kind of like the biopsy that we talked about before. We numb the area over the thyroid and we go in with a probe, very similar to the needle that we use to do the biopsy. And now we use radiofrequency, carefully controlled amount of energy flowing through the electrode that will then degenerate the nodular tissue. And then what happens is, by itself, over the next few weeks and months, that tissue just sort of flows out of the body. And if you see here the beautiful results in this patient here, how big it was, and now the neck is flat. And if you look at the second picture, that is quite dramatic. Okay. And just to also mention that when it comes to biopsies, 95% of nodules are benign. So it's only a very small percentage, 5% that are, so I'm sorry, 95% are benign and 5% are cancerous. These are some results in a study of 236 patients who had the procedure done. And if you look at over 6 months, and then to the last follow-up, the mean volume reduction was 84.1%, which is quite good. That's pretty remarkable. And 28% had complete disappearance during follow-up. So the results so far in all the studies have been promising. Now we have Jen here, as I mentioned, and these are her pictures showing the before and after her procedure. So I'm going to let Jen come on now, and she's going to share her experience. And then afterwards, we'll answer any questions that you might have.
All right. Well, thank you, Dr. Mian, for having me on here today. It's been really neat to listen to you talk about RFA. And I don't know if you can see on my shirt, it actually says thankful. And I chose to wear this shirt today because that is actually a very good estimation of how I feel about this procedure. I'm extremely thankful. In fact, that doesn't even cover it, that I was able to have RFA. And so the reason that I am what I am today, I am a YouTuber now, I have a blog, and I run a patient support group, all focused around helping patients with thyroid nodules. The reason that I do all of those things is because I myself am a patient, as you said, and I have a very strong passion to help patients who are struggling with this because it is so difficult to go through. So let me just kind of back up and give the story of how all this started. So in 2014, I was diagnosed. It was like you said in the presentation, it was found incidentally. My doctor was just talking with me, and he stopped and he looked at me and said, "You have a lump in your throat." And so I was sent for a workup and found out I had multiple nodules. And I was terrified because at that point I thought nodules meant cancer. But after the workup, thankfully, everything was benign. And I was sent to an ENT, and that ENT gave me the option of take out your thyroid or take this medication to suppress your thyroid or do nothing. And since I had no symptoms whatsoever, I was not interested in surgery, nor was I interested in medication at that time. So I just left it alone for a while. And I went on with my life for a few years, and I had a pregnancy in 2015 that did, I believe, cause the nodules to grow somewhat. And by 2018, I was feeling really horrible. I just was really tired and just not feeling like myself. And by early 2019, I thought I need to find out what's going on with me, and went to the doctor, and all of my labs were perfect, but I had this big mass on my neck. And so I was sent back to the ENT, and the ENT says, "Yeah, you've got this big thyroid nodule," and all of those previous multiple nodules had just grown together into one giant super nodule. And he says, "You really need to have this taken out. It's only a matter of time before this becomes a problem." And I was just not excited about that option because I had a very difficult surgery experience in the past. When I was 18 years old, I had a knee surgery, actually 2 knee surgeries within a week of each other, that completely changed my life. I never fully recovered from those surgeries. Without getting into all the details of what happened, I had a serious case of staph and almost died. And it was horrible, horrible, traumatic experience. My body was just devastated by all of the effects of that. And I was told several years later by a specialist that I saw about the same knee that has continued to bother me ever since, that I should never have surgery ever again unless I'm dying. So at this point in time, when the doctor says, you need to have surgery, I'm like, well, I'm not dying. I don't want to have surgery. So I'm just going to keep doing what I'm doing, and hopefully maybe it'll shrink and go away, or at least not become a problem. Well, that was in February of 2019. And by May of 2019, I had a urinary tract infection, and the antibiotics that I was given actually caused an allergic reaction. And the nodule that had just been measured in February doubled in size from this allergic reaction. And it was at this point, I needed a medical intervention. I was having severe symptoms of compression. My trachea was deviated quite a bit. My airway was compressed by 50%. And just turning my head to the side would make me feel like I was going to pass out. It was terrifying. And I was choking on every bite of food. It was just a nightmare that I was living with. And at this point, I thought, I've got to do something, but I still was a terrible candidate for surgery. And so one night I was up and I was reading and trying to find some alternative, and I stumbled across RFA. And I found the website actually for 2 physicians in Utah who were doing RFA at that time. And the image of a neck that had been treated with RFA. And I thought, this could be the answer. And so fast forward to July of 2019, I had my first RFA procedure done. My nodule was quite large. It was between 65 and 75 milliliters in volume. And it was 4.5 centimeters wide right here at the level of my trachea, or I'm sorry, at the level of my collarbone, but part of it actually extended below my collarbone. So it was very long and also wide. So at that procedure, at the time of that procedure, I had 80% of the nodule treated. And within a week, I started to feel better. And within 3 months, my neck looked almost normal. And within 6 months, my neck looked completely normal. And I felt completely normal, which was absolutely just mind-blowing to me. However, there was still the portion that was below my collarbone at the time of that first treatment that needed to be addressed. As the nodule shrank, that portion did move upward. And so in March of 2020, I went back to have my second RFA procedure done. And I literally had it done on the last day that they were doing procedures before everything stopped for COVID. So I just barely got in in the nick of time. But I had that procedure done. And I have 0 symptoms anymore. My neck has shrunk 3 inches in diameter or in circumference. And I don't have the exact volume measurements at this point in time, but the nodule has shrunk somewhere between 70 and 80%, possibly more than that. I'm actually due for a follow-up this summer. So I am just absolutely so thankful that I was able to avoid surgery, and that, as you said, I'm not having to face the possibility of being on a lifelong dose of medication. I was actually told by the ENT I would have a sizable scar because my nodule was so large and because part of it was behind my collarbone. So I'm very thankful to not have a scar. And I'm just so, I have such gratitude for what I've been able to experience, that's why I do what I do. And so I have the Facebook group, Thyroid RFA and PEI Testimonials, which is a place where patients can come and look for resources on this procedure. They can find stories from other patients who've gone through this already. And we actually have a list of doctors in our file section of the group, so a patient can find a doctor that's closest to them. So that is available for anyone on Facebook who wants to join. And then I also, as I said earlier, I have the YouTube channel called It's Me, Jen Again, where I do my best to create content in layman's terms for patients to be able to understand what this is all about. So.
Great. Thank you so much for sharing your story. That's
Absolutely.
Amazing. Yeah. How actually amazing to hear how what was, below the collarbone also came up then, and you were able to get that treated, because we call that substernal goiter. Mm-hmm. And that is it's usually a very large surgery, as you mentioned. So that's great. I am going to pull up some FAQs that we prepared together. And after that, if anybody has any questions, we will be taking any other questions that people have. So let me pull that up again. Okay, so some questions that people might ask, how quickly do I see improvements in my thyroid symptoms? Now, as you saw, Jennifer said, I think within a week, you already saw an improvement. We expect to see improvements as early as, let's say, 1 or 2 weeks, and also over the following 6 months, and maybe even up to a year. Some possible post-procedural symptoms that patients might experience. I'll let you talk on that, Jen, if you've experienced anything.
Sure. Yeah. With my nodule being so sizable, after the first procedure, I was a bit sore and I did have some swelling. With smaller nodules, as with my second procedure, there was less there left to treat. So after the second procedure, I was not swollen at all and I was not very sore, but I did find that an ice pack did help prevent that swelling that I had the first time. I know also I've heard patients talk about having soreness in their neck or their shoulder and sometimes in their ears. That generally is not something that lasts very long, maybe less than 24 hours. So, and then as you say on your slide here, fatigue, I did feel a little bit extra tired for about a week after that first procedure. The second one, I was hiking the next day. So I think it does play a role how large your nodule is and how much tissue you had ablated, exactly how you're going to feel after the procedure.
Okay, great. And can I have COVID vaccine post-thyroid RFA or just before my thyroid RFA? So there's no contraindication to getting the vaccine. Can it be performed on malignant tumors? And the answer to that is no. If you remember the chart that we talked about, who knows in the future with changes in technology, and maybe that's something we can hope for. But as of now, no, because anytime there's cancer, we need to make sure that it's all out. And especially if there's concern for any lymph nodes, if there's any concern for spread of the cancer. What are some common complications of thyroid RFA and how often do they happen? So again, I don't like the word tumor, but is there the chance that the nodules can grow again? Potentially, yes. And over a 5-year period, that percentage chance of it growing is about 20%. Okay. There can be, in very rare instances, the skin could get burned if the equipment gets overheated. Again, if done in a very careful manner, this should not happen. Of course, anytime you are breaking the skin with a needle, there's the chance for infection, but it's also, again, very rare. Having some bleeding, and then a very rare thing that could happen is an abnormal heart rhythm. However, that is during the procedure. There are pads put on for grounding to prevent any kind of electrical charge causing any heart problem. However, I would say that if anybody has any kind of like a pacemaker or anything like that, that is a contraindication. So that person would not be a good candidate to get this done. And that brings us to the next question, that who would not be a good candidate for thyroid RFA? And that would be, again, somebody who has a malignant or suspicious nodule, or somebody who has a pacemaker or other implants that might cause issues with the electricity. Okay. And then indications, patients must have 2 benign biopsies of every nodule that is going to be ablated. And that's to make sure, especially when you have a larger nodule, the more samples that you get, the better chance you have of ruling out cancer. Because if you think about it, like in Jen's case, hers was about 5 centimeters, actually more than 5 centimeters. And there's no way to biopsy every single cell in that nodule. So we do it based on, it's percentages. So doing 2 biopsies, having 2 negative biopsies, there's a higher percentage chance of there not being any cancer. Okay. Insurance coverage. As of now, most insurances do not cover this. However, at our office, there was one patient's insurance who said that they would cover it. Looking forward, we are hopeful that it will become something that insurance companies start covering. So stay tuned for that. Some post-procedural monitoring protocols. Again, as Jen mentioned, you might have a little bit of swelling, but usually there might be some pain and some swelling. We keep in touch with patients. And of course, if you do have any issues, the office is always available. But again, there's not that many side effects. And on the day of RFA, I'll also have Jen, you can talk about your experience, what the day was like.
Sure. I had my procedures done at the University of Virginia Hospital. So my experience is a OR experience. I know a lot of physicians are doing this procedure in the office. And so those patients have a little bit of a different experience than I did. But I just went to the hospital, and they prepped me for like I was going to have a surgery, and put me in a hospital gown and a cap and everything. Took me in the OR. We did the procedure. I was awake, and I did have something to help with anxiety, but I was very comfortable the whole time. During the procedure, I could not feel any pain, just a little bit of pressure. And from time to time, the doctor would ask me, to speak, to monitor my voice. And I was completely comfortable the whole time. And then afterwards, just take it back to recovery to sit there and be monitored for, I think, about an hour. And then I went home. So I was at the hospital from about 7 a.m. until noon. And I went home and rested the rest of the day and ate and drank as normally. So it's a very easy procedure to have done. It's way easier than in a major surgery, where you're going to have to be put to sleep and be admitted to the hospital. So.
Great. I remember when I was doing my fellowship, one of my attendings that I used to do thyroid biopsies with, he would joke with his patients that you can do whatever you want. You can, go out, you can go jogging, you can go dancing. Now that was with biopsies. So I would say to maybe take a little bit more caution, just kind of come home and rest. But yes, it's nice to hear that, you were, especially after the second one, you're able to go hiking right away. That's amazing. So pre-screenings that you'd have to prepare for thyroid RFA, again, you'd have to go through the 2 negative fine needle aspiration biopsies. And we would make sure that you have no major health conditions, like we mentioned before, like any implants, pacemakers, anything that would interfere with the equipment for the RFA. And that's it for a presentation. If anybody has any questions, we do have Shirley, who is with the company, Taewung. And so if there's any questions, she will be sharing them. But in the meantime, if there's anything else that you would like to share, Jen.
Let's see. Well, I know you and I were talking about how your practice is located very close to the Canadian border. And I know that in our Facebook group, we're up to nearly 2,000 people, which is just completely mind-blowing to me at this point in time. I started the group right after I had my first procedure, and I never really anticipated that it would ever grow to that amount of people. But many of our patients in the group, we have patients worldwide, but many of them are Canadians, and there's no access to RFA in Canada. So many of them come down to the US to have treatment. And so I was thinking that because you're so close to Canada, you most likely will have a fair number of Canadians coming down to have treatment, because they like, everyone who looks into this procedure is just very interested in preserving their thyroid and not having to undergo surgery. So I'm very glad to know that we have another physician close to the Canadian border for that purpose, and for just the people in your general vicinity as well. So, my office is literally 30 minutes, probably not even, away from the border. And we are happy once people are able to come over. We're happy to, work with people to get this done. And, we are actually the first office in Michigan that is offering this procedure. And we have 3 physicians. All of us are trained in this. We trained in Utah. And
I believe in the Midwest, there are not that many options.
No.
So, yeah.
No, actually, it was just I created a spreadsheet of all of the different doctors who are known to provide RFA in the United States last weekend. And there are 68 doctors on that list. And I'm in Alabama, and there's no one in Alabama offering this procedure. The closest doctor to me is 4 hours plus away. So yeah, besides your location, and there's a doctor in Kentucky, and there's a doctor in Iowa, and then I think the next closest one is in Georgia. There's a huge desert in the middle of the US with very, very few of these doctors. The majority of them are located in California and New York. So, it's amazing that in your practice alone, you have 3 different physicians who are trained in this. So that's excellent.
Yeah, we love providing our patients with state-of-the-art care. So, that plus, as I mentioned to you when we talked before, I also have an interest in functional medicine. And for me, saving the thyroid, because I know what kind of effect it can have on a patient to lose their thyroid. And there's a certain percentage of patients who, even if their numbers are good on the thyroid hormone replacement afterwards, they never feel the same. They will say like their numbers are good, but they're like, I just never feel the same. I've gained weight and I can't take it off. I'm losing hair still. And that's despite, having very good numbers. And like I said, nothing can compare to our God-given thyroid. So it's an amazing blessing to have this option. And I do see that we are getting some questions. So one question was, is that 2 negative biopsies in a year? If not, in what time span? So it's not in 1 year. When I spoke with, we usually, and say about within maybe 2 years, but, we definitely don't want, if there was a biopsy from say 15 years ago, we would probably want to get 2 that are a little bit closer. How long does it take with the probe in the nodule at 6 centimeters by 4.5 by 3.5 centimeters? The actual procedure does not take very long. Even if it's a large nodule. In one case that I did, I actually did 4 nodules in a patient. They were kind of, somebody might look at them and say they're separate nodules, but they also kind of looked like they were all together. And even with that many, it took less than an hour for the entire procedure. What do you feel is the root cause of nodules? Can it be corrected by changing the diet to plant-based? So I definitely believe that diet is important no matter what. When we look at the root cause of any kind of illness or disease, diet plays an important role. There is some correlation between, people who have Hashimoto's more likely to have nodules. And, if we think about what is Hashimoto's, it's inflammation of the thyroid gland. It's autoimmune destruction, and there's an inflammatory response there. As far as nodules shrinking, I never like to say never. I mean, they can shrink. We know they can by themselves. Usually it's the smaller ones that kind of just like absorb into the tissue. When they're larger, and especially when their consistency is they're really kind of tough, the tissue is, those are less likely to shrink on their own. But I mean, I believe that there's no harm in trying a plant-based diet or whatever kind of diet you would like to try, because it certainly can't hurt. And who knows, it could help. Maybe they'll shrink a little. Some people who have Hashimoto's, and I've seen this where they have TPO antibodies, that are high when they cut out certain foods, such as gluten or dairy, soy, their antibodies can even come down. Now, again, the longer you've had it, and it might give you an indication, like, is this going to shrink on its own, or will diet may have an effect? I say, why not try diet? Anyways, you're eating healthy. So, would you like to add did you ever try dietary changes yourself?
I did. I actually was going to ask if I could comment on that. So because I didn't want to have surgery at the very point of diagnosis, I tried lots of things to see if I could shrink my nodules. And I do know that I have a gluten sensitivity. I am gluten-free, and I'm sensitive to eggs. And so I've taken that out of my diet. However, for years of doing that, I didn't see any changes. I've tried a lot of, supplements and, natural remedies. And I even took one medication at one point, that, there was a study out that said that it had shrunk rats' tumors. It didn't make any changes. And so, as you said, it's worth it to try if you want to try something, but there's not anything that I've been successful with. And I feel like the closest thing that I have found to, as far as dietary changes that has been, at least has some backed up, some evidence to back it up, that might support helping thyroid nodules is ketogenic diet and intermittent fasting, because of the effect of autophagy on tumors. I did practice that I still practice that for a time, and did have, ultrasounds to see if there was any changes, and there was not any changes. And I actually have a nodule on the other side that was not treated by RFA. It's a smaller nodule, so it's not been needed to have RFA done on it. But I thought this will be my control, to see if these dietary changes make any changes in the size of it. And it did not make any changes. However, it did not grow either. So it may not be helpful, but it most likely would not be harmful either, in my opinion. And if people want to learn more about what I'm discussing here, you can Google the word autophagy and just see the effect of autophagy on tumors and whatnot. So those are my thoughts on that.
Yeah, no, thank you for sharing. Again, I believe there's value in trying for oneself, because you don't want to afterwards, ask yourself, oh, maybe this would have made a difference. It's like, nope, I tried it and it didn't work. So now, of course, it's worse when it comes to surgery, because now it's a question of losing your thyroid or not. So even if you have RFA on, a nodule afterwards, you're not going to feel that sort of, oh, well, I should have tried this or that, because you haven't lost your thyroid, which is great. Yeah. And I agree with you. I didn't want to come out and say, well, they're unlikely for big ones to shrink, because I always like to, I don't like the, never like absolutes, because at the end of the day, we just don't know. Some people might see some changes, but I love that you, really advocated for yourself and educated yourself and tried all these things, so that you have this peace of mind that, okay, I've tried everything. I also recommend for people some people, it's very clear that, okay, their thyroid is very large, their nodules are large, it's causing symptoms. For people who have nodules that maybe aren't 5 or 6 centimeters, maybe they're in the range of anywhere, I would say from 2 to 5, 2 to 4. There is some, actually, for really large nodules, there is the belief that it's better anyways to have them treated, because they are large. And but when it comes to questionable, is this causing your symptoms or not? If anybody has any question, you could always see an ENT doctor who can see okay, is it causing any kind of, pressure on important structures in the neck? We can see that partially from the ultrasound, and I know they have their own testing procedures. So if you really want peace of mind for that, to just see, okay, because sometimes people will come in and they'll have different kind of symptoms, and sometimes it's their reflux, acid reflux that is causing their symptoms. It's not the nodule. But for large nodules, yes, the probability of it being a cause of symptoms is higher. And the beauty of this procedure is we're not getting rid of the thyroid. It's not a question of are you going to have a thyroidectomy or not? It's, you're still going to have your thyroid. We're just going to shrink the nodules. There is another question here. I was told by my doctor that he can't do RFA and after that do the parathyroid gland surgery, as with the RFA gland will be manipulated and I have big benign nodules. Only option is to remove thyroid and check which parathyroid gland is not good. So to be honest, without knowing a little bit more about that case, I would not want to give any kind of absolute answer. I'm not familiar with any contraindication, but again, I would, the most important thing in any physician-patient relationship is to choose a doctor and that you choose a doctor that you trust and keep that open communication. It's important to trust your doctor. And, from there, if you have any question or doubt, you could always get a second opinion. But I hold that relationship very sacred. So I'm really not sure about this situation. Is there any evidence between having a connection with removal of tonsils, a cause of these nodules forming? I'm not aware of a correlation between that. And maybe Jen, I know that you probably were looking for a lot of causes. Did you ever come across anything like that?
I did not. Everything I've read about how nodules develop has pointed me to the understanding that every person has a different root cause, that is multiple factors at play. And so that's why I think there's no one way that we can, as far as like diet changes and lifestyle changes, there's no one way that works for everyone. And so I get asked that question all the time. And, I wish I could say, yes, take this pill or, or eat this way, but it just doesn't apply across the board. I did have a car accident 1 year prior to my diagnosis with thyroid nodules, in which I was T-boned. My vehicle was T-boned on the left side. And so I always wondered if the trauma to my neck from the whiplash might have been a factor, because I have heard other people say that they had a car accident just prior to their nodules forming. But I don't believe that it was just that in a vacuum. I believe there were probably other factors that contributed to it as well. It has to be a perfect storm. So.
Right, exactly. And in fact, some people who tend to form nodules or cysts in one area of the body, they tend to form them in multiple areas. So yes, oftentimes we see people who have thyroid nodules, they have a renal cyst too. And, in other places, lots of other glands as well. And again, most of the time, these nodules, they're what we call incidentalomas. Like you might find them in the adrenal glands, and they are usually not cancerous, and they're not usually hormone producing. So now, actually, Jen, we did talk about a little bit before we came live about the difference between hot nodules and cold nodules. And again, when it comes to that situation, I would recommend talking with your doctor, because it would have to be on a case-by-case basis. Where I trained, the doctors did do ablation on hot nodules. So when we say hot nodule, we are talking about nodules that are producing extra thyroid hormone. So they are hyperactive and is causing a hyperthyroidism in the body. And again, it would have to be on a case-by-case basis, but I do know that where I trained, they did do those. So I think that's it with questions. And I can't think of anything else to add right now, other than this is really a really exciting, it's a really exciting procedure in endocrinology. And I'm so happy that we're able to provide this for our patients. And like I said, save the thyroids. That's our goal. That's our mission.
Absolutely. That's my goal, is to help as many people as possible be able to avoid any unnecessary thyroidectomy and save their thyroid. Anytime I can help someone to find out the information that they need to educate themselves on this topic, and it helps them in that way, it makes me very happy. So I appreciate you, Dr. Mian, offering this procedure to your patients and your care that you have for, valuing the thyroid. So many physicians that I've encountered and that patients in our group have encountered just don't seem to value the thyroid. They're just like, oh, just cut it out. It's no big deal. And you'll be fine on this little pill for the rest of your life. And I think intuitively, so many patients just don't agree with that sentiment. They feel like the thyroid is important. It's there for a reason. So it makes me very happy to hear how much you value the thyroid and your practice as well. So thank you for what you're doing.
Thank you so much. And actually, one thing I wanted to add, when you talked about the value of the thyroid, there's 3 hormones that are absolutely essential for life, without which people can actually die. Mm-hmm. One of them is insulin, the other is cortisol, and the third one is thyroid hormone. Mm-hmm. And sometimes it doesn't get the respect that it deserves. The thyroid gets blamed for everything bad. That actually, without thyroid hormone, sometimes I have patients who will come in, they just kind of stop taking it because they don't realize. Now, some people will just start to, feel poorly, but there's some people can actually go into a coma and it can actually lead to death, wow. Without taking their thyroid hormone pill. And so, when we look at the hormones that are essential for life, it's up there in the, there's 3 of them. So yeah, well, I thank you so much, Jennifer. It was such a pleasure meeting you. And I love that you've made this your mission to help other people with something that has really benefited you in your life, and your, the way you are so open and giving to share this, which is something you don't have to do, but you're doing it for the spirit of generosity and giving. So thank you so much.
Thank you.
All right. And so if anybody has any questions, you can reach out to Jen anytime. And, if there's any questions for me, she can pass them on. And have a beautiful weekend, everyone. Hopefully maybe we'll do this again sometime.
Thank you.
All right. Yep. Take care. Bye.
Bye.